Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Jeremy Rosario Maldonado. Thanks for joining us today, Jeremy.
Yeah, thank you, Kim, for having me speak to your audience. It's a great platform what you're doing to connect physicians and healthcare workers that are with a similar background.
You're welcome, and thank you for joining me. I'm really happy to have you. And by way of brief introduction, Jeremy is the VP and Associate Creative Director at FCB Health New York, which developed the Disappearing Doctors Wellness Initiative. Jeremy created a powerful art exhibition entitled The Disposables, which calls attention to physicians lost to suicide. And I would like to dedicate this episode to my own doctor, who I lost to suicide 2 years ago this week. And I'd also like to give a shout out to Dr. Stephen Palenchuk, who was scheduled to join us, but he was called to work in the ICU. And it just goes to show you the sacrifices that physicians make on a daily basis. So thank you, Stephen, for all that you're doing and the lives you're saving today as we speak. And I will have Dr. Stephen Palenchuk on at another time. And today we'll be talking about how Jeremy came to care about mental wellness for physicians and the background and description of his project, The Disposables. And we also want this to be a message of hope for physicians. So we're hoping to impart that as well. So what would you most like our audience to know about you as we begin our conversation, Jeremy?
Okay, well, thank you for the introduction. Just a couple of things. I came to FCB Health about 3 years ago. And outside of the regular work, I also got involved in a really interesting initiative called Disappearing Doctors, which it was the first time that I heard that data of 400 doctors die by suicide every year, and that was way too many. It is really a heartbreaking uh, issue. What's happening? One of the great things about the agency, FCB Health in New York, is understanding that creativity can have the power to really fix, bring awareness, but also a call to action to change some of the hardest things facing our communities. And I was trained as a graphic designer in advertising. I'm from Puerto Rico originally, came to Ohio to study art, and the visual communication space has always been uh, kind of my platform. I think, fast forwarding again and just learning more about some of the real issues and struggles that physicians were facing, I wanted to do something about it, which actually you talk about that song before. Do something, right?
Yeah.
That's the let me see. There's a couple of things that I wanted to mention too about the journey of starting that initiative. Not only it gave me an understanding what burnout can do and some of the real pressures that physicians are facing. Um, think of this. I mean, somebody that is doing a 120-hour rotation, um, they're just giving their all just for the sake of communities and really being able to heal people. One thing that I noticed is I also volunteer as a translator in a free medical clinic. It's a ministry to really help those who are without insurance. And one thing that I learned about doctors working alongside this kind of initiatives is how they have the extreme busyness of their work, but they will come to this free clinic at night to really care for people. And it gave me a deeper understanding of what their passion is all about. And it lies on healing and helping communities and people and making a difference. So I started asking myself, what is different about an institution versus this free medical platform? And when I asked some of the providers, they would tell me, "Hey, Jeremy, here we feel like we can practice without the regular stressors that come with practicing medicine." Um, Within that, I think again, just I'm hopping all over the place. I think it's a little bit of attention deficit, right? When the Disappearing Doctors was created again as a way to bring some tools and help, very much help needed to help providers. They began the project in 2020, 2021, and one of the sad realities that we learned is that when we started this project, some of the physicians from the disposable portraits, they were still alive when we started this thing. And that year, they launched an initiative with CERMO, providing a safe haven of confidential help for physicians to call and get the support they needed without repercussions. Um, being involved after that campaign was done, we had the idea of what if we create an art exhibit to really, as a call to action uh, to generate tribute of the doctor's loss, but also to provide help for those who are suffering in silence. And the idea was, it was simple. What if we do portraits of physicians who were lost to suicide, and the medium, instead of paint, I wanted to do this gluing medical objects and to create these portraits. And to me, it was a really hard challenge because I've never done anything like that. I've been trained as a designer, but I love painting portraits. So being able to look at objects differently to see how can we juxtapose them to create a similarity to the doctor lost. It was a huge challenge, an emotional challenge from learning about the stories and also from the medium itself, using the very same objects the doctors use every day to save lives. But now in this case, they're used to paint a portrait of a life lost. Those same items that they would have been holding every day. It became the very culprit to the created the object. We brought a couple of things too. Initially, when I wanted to gather some of the medical supplies, this began a year ago, 2 years ago, collecting items. Every institution that I had contacted about the idea of not pointing fingers at any institutions, but can we collect some items to really help create a better future for doctors. And anonymously, almost every institution told me, no, this is too dark of a topic. We can be, they were afraid that this will create a assurance that suicide was a way out. But interesting enough, I didn't want to give up thinking, okay, there's a problem. We really need to save lives. And I contacted directly nurses and doctors that I knew through the free clinic that I mentioned, and other colleagues. And to my surprise, every single person that I asked, they told me, yes, let me gather some items for you because we just lost another doctor in our hospital to suicide. And that was the beginning of understanding that this is probably a bigger issue that we know of. I don't know how many cases are underreported because of stigma. So the items began arriving at my studio, and I will separate items based on color, on value, and I will kind of juxtapose them side by side to see how can we use them to create the portraits of four really unique doctors. So the disposables became a gallery showing of Dr. Lorna Breen, Dr. Ryan Fryman, for no mind, Dr. Lang from Cleveland, and Dr. Scott Jolley from Utah. And all of those cases, they were phenomenal people, loving husbands, fathers, wives, with Dr. Lang. And it's really heartbreaking just to know how burnout got to their brain in a way that they thought the only way out was this tragic ending. And I think as a visual communicator, one of the hard things is knowing that these tragedies could have been prevented if there were some tools available, some really good support. Let me see. We launched it in September 17 last year, and part of the event, it was very successful in my opinion because we invited the head of the medical board, some medical leadership in the state of Ohio. We partner with the Ohio State Medical Association to launch one of their confidential questionnaires. And the way that I curated the event, not only we invited that medical leadership responsible for making changes, but also the wife of Sarah Fryman, Brian's wife, to share about his journey with and how hard it was for a lot of people to hear. I think that seeing a face, but also hearing from loved ones, it really made an impact there. Ryan, when after COVID, the practice had lost several doctors due to business, I guess they call it. And he was still out of his own pocket paying the staff. He had that kind of love. He started a addiction recovery medicine practice. He saved so many people recover out of addiction. And through all that, I mean, those years as I was interviewing people, I would learn terms like, pajama time, thinking, you're working 80 hours a week, and then you get home at night and you still have to go back and forth with insurance companies just over anything you're prescribing. And I think the churn and burn like that of nonstop, that really it's really hard, I think, for a lot of doctors, depending on what the rules and regulations are in the state, knowing that getting some mental health help can cost you your license. And when we launched that exhibit in September 17, 2023, the benefit of it 3 weeks later, I think this was already in the works, but having the right people in the room to want to create action, I guess, for it. 3 weeks later, the medical board removed invasive mental health questions out of credentialing, which is something that we were advocating. And to me, I think that was a huge win, but I didn't understand the implication of that until weeks later. I went to see, for example, a specialist, just a checkup, and he asked me, doctors, since then I tried to be so supportive and in conversation and assuring of how grateful I am for their service. And this doctor asked me, "What do you do?" And I told him, "Well, I'm a creative director, but I'm an artist, and I just got involved in this initiative." And I told him about the removal of invasive mental health questions, and he told me I'd be back. And he left me in the room, and he went and told all the other doctors in the practice. And things like that, I realized, wow, this is it's a big issue, but I think it's also a step in the right direction in helping change policies that will really help our doctors. Let me see. I think in a nutshell, I think it has been an initiative of community support. There is a lot of people that love and they want doctors to be well cared for. Again, they're giving their heart and their all and their lives to help save communities through many illnesses. And it is our time to really do something, to help those who are struggling and provide hope.
Well, absolutely. Well, thank you so much for all you just shared and all you're doing. And it's an incredibly powerful project, and you can already see the ripple effects of what you've been doing. And I think you highlighted something important, that talking about suicide doesn't increase the chances of suicide. If anything, it can save a life when we're raising awareness and talking about things and sharing resources for help and telling people that they matter, they're never alone. And I think that's very important. And with my own physician, it's kind of a process or journey for me when I talk about him, because people do know that's why I'm doing this work. But what I want him to be known for is he was a great caring radiologist. He was amazing. And also he was an artist and also a photographer. And I think he went to college on an art scholarship. And just within days or weeks before he died in September 2022. And in August 22, he took this beautiful picture. So he was still seeing the beauty in life. So I feel like the work, like what you're doing, it's just so beautiful and so powerful. And also, so because I want him to be remembered as a great caring radiologist, you don't want him to be remembered just as a doctor that took his own life. But sometimes we do need to say their names because it's a huge airplane of doctors that's dying every year, right? But if you just tell somebody, oh, my doctor, because nobody in my life knew him, so it doesn't have the same impact. So sometimes it is important. So this was my doctor, Dr. Stevens Ferlaza. So this was him, right? He was a real person and a real doctor. And it doesn't matter why. Sometimes it's related to medical things and sometimes it's not, but he was a person and he lost his life, and with it, we're all doing this work to to move the needle and make things better.
Yeah, great.
And so one thing, so I had printed out, I think I told you, this article by Donna Baver Rovito speaking to your work. And it starts out, Justin Kovarsi, that's your coworker. He's the VP and creative director at FCB Health in New York. And he says it's not a personal failing, it's a societal failing. It's not about weakness and it's not about personal strength. You can't just necessarily tough it out. It's about what we as a society are doing and how we're failing in relation to the silent epidemic of physician suicide and burnout. I want to know if you wanted to add anything to that.
It is true, and I think initiatives like the disposables trying to bring awareness is causing now uh, change. Just to give you an example, last year, most of the places that I reached out to begin the exhibit, um, we were denied the space, because of the topic. But this year, understanding that it's a societal thing, I think institutions are starting to realize that they really need to begin helping their staff, doctors and other medical health care workers. Um, we're this year kicking off this Thursday and Friday mental health awareness program with Wexner Center Medical Center, I'm sorry, in Columbus, Ohio, and Children's Hospital in Cincinnati on Monday the 10th. And to me, I'm thinking it's such a contrast from last year that this year institutions are using the artwork um, to help doctors come forward and talk in a safe space and knowing that they can get the help they need. So I feel like the needle is going to be changing if we continue the advocacy work and uh, and just continue growing a coalition of institutions and leaders that can really help us move the needle in that direction. Right?
Absolutely. And I would like to give a call to action to healthcare systems. And a lot now have systems wellness officers, but I want to call them out and say you need to give them enough time and resources to really make a difference, because I've reached out to some wellness officers and asked them if they feel that they have enough time and resources to really make a difference, and they do not. So you don't want it to be some token thing where they just say, oh yeah, we have system wellness officers. You have to really care and really want to make a difference and put your money where your mouth is, and offer the time and resources to those system wellness officers so they can do their job.
Yeah.
And so another thing in this article said the epidemic is so silent that many medical families and physicians are themselves unaware of its severity. And the article speaks to Betsy Gall and her book, The Illusion of the Perfect Profession, about her family's horrific loss. And Betsy noted that she was unaware of the physician suicide crisis herself as the spouse of a husband who died by suicide. And Betsy and Pamela Hobby and I wrote an article for Kevin MD, and we shared a podcast about it, and I will link that when I share ours. Have you spoken with Betsy yourself?
No, no, no.
Okay, yeah, and so that's really important to know. Again, raising awareness that so many people still aren't aware that it's an issue. And so that's amazing. So when you said that, that's in the article too, that you said it's a creation of portraits of doctors who die by suicide using the items they would have used to practice medicine, the very same tools used to help patients heal. And I just think that is so powerful.
Yeah, yeah. people that have come to the exhibit, they say that they're thankful that we're celebrating their lives and the portraits are full of light and hope. I mean, even though it's a dark topic, because it's about honoring who they were. I mean, and you know, as you know, this is an issue that it doesn't only affects the immediate family, but you know, patients that have a relationship with those doctors, um, coworkers, and I feel like there's more to be more help that needs to be addressed in order to help um, that larger ecosystem of how people are impacted. I think I read a statistic that if we lose a doctor, 2,000 patients, they don't get treated per year, which is huge. But then you think about the also the impact that a suicide has into a family and coworkers, and is it's such a complex thing that it's on the note. I think back to your question earlier, some institutions are starting to do some things about it. I did receive data from the Ohio State Medical Association CARE program, the confidential assessment that we help kind of promote when we launched the initiative. And I think after 3 months after the exhibit, 80 providers had asked for a follow-up, a confidential follow-up. To me, I'm hoping that that's a reflection that we're saving lives.
Yeah, well, that's good news, and that led me to the next thing I was going to bring up, where the article said the Disappearing Doctors campaign to raise awareness about suicide and physician mental health and the stigma which prevents many medical professionals from seeking help when they need it has allowed numerous organizations to combine their efforts. And you said that you've been growing a coalition of like-minded organizations that are bringing forward some effective ways to really mitigate and bring solutions to the system and help our heroes. And you mentioned the Lorna Breen Dr. Lorna Breen Heroes Foundation, and I'm an ambassador for that. And you also said the exhibition has created connections of many healthcare leaders that are seeking to bring effective healing to our healers. And you said it's igniting a great momentum to make systemic change to improve the healthcare system. So that's where I feel like we can share some hope.
Yeah. Yeah, and there are institutions like the American Medical Association Foundation and the American Medical Association. You see, we actually took the work to their annual meeting in Nashville and also in Chicago. And I had the opportunity to meet some lovely people. In Nashville, I learned more about how the AMA association they're actually creating some tools for spouses also to recognize when their husbands and wives are going through burnout, what to do at the helm, and there's some great resources out there. And my apologies, is the American Medical Association Alliance. That's the one in with the spouses, and
Sure.
the foundation. We took the work to Chicago also, but it's neat to see conversations and actionable steps in bringing tools. I think also through some of this exhibits where I've taken the work, conversations with doctors, they all open up and everybody knows at least, you know, several colleagues who had died by suicide. And it me as an artist, I feel different. I think because some of the stories can be so heartbreaking, and you know, even for current doctors who are afraid to get treatment because of fears of having their insurance companies know that they have seen a counselor for you know, suicidal thoughts. I hearing stories, you know, we had in one of the exhibit a physician talk about burnout, and he explains how he had to get a 3-week treatment outside of the state where he practiced at a cost of $80,000 for 3-week treatment that he had to pay from his own pocket. And you know, stories like there's a ER doctor too who had shared how the ambulance brought in a 6-month-old baby that the stepdad had raped, and the team couldn't save the baby. So I think beyond just mental health help, I think we need to begin thinking about tools and how do we help our medical staff and teams unpack some of the strategies they see and walk side by side with them on how to help that. I've been thinking about a lot of some of the systemic changes that needs to take change, because there are just so many hard things that they encounter, that
Yeah, you're right. The trauma that they have to deal with on a daily basis. And one of the first people I interviewed for this YouTube channel was Dr. Joe Sherman. And when he shares, his own journey and the support that he receives, and he said regarding those questions that when they ask, if you sought support for, mental health, and it should follow up with, and if not, why not? That every doctor need, when you think the ongoing trauma that they see all the time, they absolutely need the support. And just to again speak to the Dr. Lorna Breen Heroes Foundation, which is focused on removing intrusive mental health questions from state medical licensure applications. And they're trying to do that for every state in the country. So no doctor needs to fear, or healthcare worker, repercussions for seeking help. And I love it that you shared in this article that healthcare professionals have told you that this campaign has given them the strength to speak about their burnout and mental health and seek necessary help.
yeah.
And yeah, and then also you added, or she said, or Justin was saying, Jeremy and I have found in our research that there's a societal shift, that there are more willing to talk about it, but at the same time, it's about having the right resources, not just any resources.
Correct. Yeah.
And so yeah, so I think that it's all just so important. So thank you again for your work. It's very powerful. And how can our listeners get in touch with you, Jeremy?
Okay. Well, listeners, they can follow us on social media. Go to Disappearing Doctors on Instagram. We have a Facebook page, and in X also, just to learn more about some of the initiatives and advocacy ideas that we're coming up with, and also to join us in this coalition, because I think we need good people around us to continue to push for meaningful change.
Yeah.
Yeah.
Absolutely, absolutely. Well, thank you so much. And I'm gonna, close the way I usually do, and then I'm gonna have us focus on the image to give all of our listeners time to reflect on this episode and what it was about. And just thank you again, Jeremy, for what you're doing. It really is making a difference. And
Thank you. It is a team effort. We have Justin and team. We have been just really driven in taking this off the ground. So
and just to say one more time, to tell the doctors and everyone else out there that you matter, you're never alone, and there's help.
you read my mind. I think if there's something that I can tell the audience, yes, you are worthy, you are important, and your life means so much for all of us. So get some help, reach out, and I'm available if anybody wants to just share their stories or just talk through that. So life is important.
Absolutely. Okay. Well, thank you, Jeremy. So,
Thank
in
you.
closing, to move the needle in healthcare, we all need to raise our voices, and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So, stand up, doctors, and let's stand up for doctors.
Okay. Thank you so much, Kim.
Thank you, Jeremy.